It's said that life imitates art, and so for the next few minutes we're going to use art to help us discuss life, and in particular, healing. What you have here before you are three paintings by one of my favorite artists. Many of you probably know who it is. Anybody want to shout out a name? Thank you, Dr. Becker. This is Mark Rothko, an early 20th century painter. And these paintings really embody some of the themes that I'm going to touch over the next 15 minutes. What you see are three paintings of varying color, contrast, proportion, and boundaries, and ending on the right with two colors that have blurred boundaries lying on a field of color that actually represents a fusion of the other two colors. And what might we call this? We might call it evolution. And what I hope is happening here is that we are having an evolving approach to healthcare and healing in this country. Another theme that I want to address is our society's tendency to create adversarial operational models. What you see before you are some of the dichotomies that came to my mind that we use every day when we're talking about ourselves and our patients. And I think we do ourselves and our patients a grave disservice when we think and act in terms of opposites. We're all better served when we acknowledge the continuity and interdependence between presumed opposites, what we might call the yin and the yang. Last year, my presentation touched on wellness and healing. We defined wellness as a state of being healthy, physically, mentally, emotionally, and spiritually. We talked about healing being a journey towards wellness. We talked about the current state of our intensive care units, the good things, the clinical results, the technology, the highly trained clinical staff, etc. We also talked about the bad, sleep deprivation, ICU psychosis, noise, isolation, inadequate analgesia. We talked quite a bit about the physiology of stress, and we'll be mentioning that more in a little while, the fight, fright, and flight response, or the so-called stress response. And we talked about corrective measures to create a healing environment. We talked about better analgesia, providing our patients with more sleep, a quieter environment, exposure to natural light. But let's look at, for a moment, what are the determinants of our patient's outcome? What you see before you is the list of what I think most of us would identify as the standard determinants of our patient's outcome. How healthy are they? What is their acute problem? How good are their caretakers or caregivers? The technology, etc. But what I want to focus on today are the other determinants. And those include the patient's baseline psychological and emotional state. What's their character like? What's their personality like? Do they suffer from anxiety or depression or claustrophobia, which can be a real problem for our patients who are intubated and have a bunch of tubes stuck in their bodies? How well are they prepared for surgery? It's been well demonstrated many times that people who are well prepared psychologically and emotionally for surgery do better. They require less analgesic medication, they have fewer complications, they have less anxiety and depression, and their stay in the hospital is abbreviated relative to people who are not well prepared. How do the patients respond to surgery? Do they feel confident about their result, or do they feel fearful about their result? Do they feel secure or isolated? Are their needs being met? Are they oriented or disoriented? Are they sleep deprived? But when you look at all of these things, you have to focus not only on the patient's conscious response to surgery, but their unconscious response to surgery. And in the context of today's conference, I'm talking about the crosstalk between the brain and the rest of the body that goes on without our patient's conscious knowledge, that greatly affects their stress response, their response to infection, their susceptibility to infection, their wound healing, apoptosis, which is cell death, any autoimmune phenomena that are going on, or their mental state, depression. On the left is a scheme of some of the crosstalk between the brain and the rest of the body. I don't believe this is in the syllabus, but it is accessible in the bibliography that I believe is in the syllabus. And we don't have time to go through this in any detailed way, but there's an enormous amount of communication between the brain and the body in all of the patients in the intensive care unit. The collaboration between the brain and the immune system and other bodily functions is so vast that some authorities on the subject believe that the classification of medical illnesses into medical and psychiatric specialties and the boundaries that have demarcated mind and body are artificial. This quote accompanies another painting by another one of my favorite artists. Dr. Becker, you were one for one. This is René Magritte, who painted this in 1933, one of the surrealist artists. And the reason I picked this is because Magritte really liked to paint about reality and boundaries and changing boundaries. And there are other things I could say about the painting, but in the interest of time, I won't. What was interesting to me was after I picked the painting, I realized what the title of the painting was. And just so maybe you can't appreciate it, what you're looking at is a painting stuck in a window of an outside scene, and it's very difficult to tell whether the painting is clear glass or a painting of the outside scene. The title of the painting is The Human Condition. But it gets even better talking about the mind and the body. Not only does it seem that the mind is more of a player than we thought in the world of wellness and healing, but according to cognitive neuroscientists, we are conscious of only about 5% of our cognitive activity. So most of our decisions, actions, emotions, and behavior depends on the 95% of brain activity that goes beyond our conscious awareness. A lot of this new information derives from new sophisticated technology, such as functional MRI and PET scanning. But the literature is really replete with other evidence. Let's just take a look at a few of the examples. It's been shown that patients who are sleep deprived have a lowered pain threshold. They experience pain more. Now, their overall ability to experience sensation is not compromised. They just hurt more easily. It's also been shown, conversely, that natural light raises the pain threshold of patients. Dr. Mehmet Oz, who's a cardiac surgeon in New York, has done a lot of work looking at patients' brain's response during general anesthesia at the time of surgery. And it's been well shown that patients hear while they're asleep, and actually they can sometimes repeat after they're awakened. And this applies to many different levels of anesthesia. They can recite to you certain things that were said at the time of the surgery. I'm sure you all have experienced this as well. In a very few patients, it's been shown using functional MRI who have brain damage such that they're categorized as minimally conscious. If they are exposed to voices who are not familiar to them, their brains will not respond. But if they are exposed to people whom they know, their brains will light up. Clearly, not a conscious phenomenon. One that I'm particularly fond of is that consonant music, or what one might consider beautiful music, seems to activate a different part of the brain than does dissonant music, or what one might consider unpleasant music. And finally, Dr. Oz has done some of the work on this as well, that aromatherapy can favorably alter heart rate variability. Heart rate variability is one means that we use to measure autonomic system balance, the conflict between the sympathetic nervous system and the parasympathetic nervous system. So I believe that our concept of mind-body interaction, or balance, is evolving. The mind and the body are not separate and independent. I personally believe that the reality of our existence may be much better represented by the third painting, the one on the right, in which the mind assumes a more prominent role in determining our physical and mental health. But it's quite possible that reality is best demonstrated by this last Rothko painting, in which there is complete unity of mind and body. Although it may project as black to you, actually what the painting, when you see the real painting, it's a series of colors, red, green, and other colors interwoven so that the boundaries between the colors are indistinguishable. So how do we create a healing environment? Or what's one approach to creating a healing environment in the intensive care unit? We have to consider not only the patient's conscious and unconscious needs. We have to positively engage the autonomic nervous system before, during, and after surgery. And we have to activate the relaxation response to counter the stress response. A brief word about the stress response. It involves heightened sympathetic tone with everything that goes with that. It involves distortion of the hypothalamic pituitary adrenocortical axis. It involves increased arrhythmogenicity, increased thrombogenicity, impaired immune response, and impaired wound healing. In 1975, Dr. Herbert Benson, who's a cardiologist in Boston, published I think the seminal work on the relaxation response. And what is the relaxation response? It actually occurs in a different part of the brain than the stress response, and it's sort of the antidote for the stress response. It produces a slower heart rate, a reduced respiratory rate, a lowered blood pressure. It reduces muscle tension and oxygen consumption. It normalizes distortion of the HPA axis. What do you need to invoke the relaxation response? You need a quiet environment. You need a comfortable position. You need a passive attitude. You have to open your mind and let whatever will come into it, but then you have to use that open mind to focus on something. Now, you can invoke the relaxation response by using meditation, prayer, or, in our case, Reiki. And so with that, Reiki is the modality that we at the George Washington University Hospital have chosen to use to help our patients in the intensive care unit experience the relaxation response with some extremely impressive results. And so it's now that I'd like to introduce my colleague, Luann Jacobs. Luann is, as I said, a wonderful healer. She's a Reiki master at the George Washington Center for Integrative Medicine and at the George Washington University Hospital. And she will be talking to us about what Reiki is, how we've used it at the hospital, and then maybe give you all an opportunity to experience it.
Joel has spoken about the mind-body connection, the vast unconscious that we have yet to fully understand or completely access in our communication with our patients. My name is Luann Jacobs. I'm a Reiki practitioner and also a Reiki master, which means I am at the teacher level. And I work both at the Center for Integrative Medicine here in Washington, D.C., and I do programs at George Washington University Hospital. But I am here to try to take you out of this mind-body dichotomy, and by speaking to your heart center. This is not that technical heart that we've been hearing about today, but this is the heart energy. This is the center of the human spirit. What is Reiki? As a Reiki practitioner and teacher for over 12 years, I've come to know and understand that the heart energy is connected to the hands. The purpose of this talk today is to tell you about the use of this touch modality at George Washington University Hospital to help patients relax, to help them to heal from procedures, and to improve our patient outcomes. In addition, I'm going to teach you some of the basic positions to be used for self-treatment, because that's where we always begin in touch modalities. We begin with ourselves, and then some of the positions that you can use also with your patients. To begin, Reiki is a Japanese word connoting the principles of spirit and physical energy of the universe. And I always teach my students, if you're alive, you have life energy. And if you have life energy, then you have Reiki. So everyone has this as part of being human. But what we maybe don't have yet is a knowledge and understanding of Reiki as a system of touch that you can apply to your patients and to yourself to not only improve your own wellness, but also to reduce stress when you're under conditions of extreme distress. Every culture has a system of healing touch, and the reason we chose Reiki to use at GW was because it's one of the safest, it's one of the simplest to use, and one of the simplest and easiest to learn to use. And it's because of this simplicity and its safety that we brought it in to the cardiac cath lab in December of 2003. Our pilot program in the cardiac cath lab using Reiki lasted 6 months. What did we do? We were available every day, Monday through Friday, for several hours a day. We saw over 400 patients. 266 patients participated in Reiki treatments and participated in our pre and post questionnaires. 13 nurses learned Reiki. What did we learn? The data from our questionnaires showed that patients were thrilled with the treatments. They found it decreased their pain and anxiety and improved their feelings of well-being and calmness and being cared for. They wrote letters to the hospital, and they shared with their doctors how they felt about their treatments. Nurses found that the Reiki presence helped them to deliver compassionate care. And by the way, they also frequently asked for treatments from us. And while cardiologists did not initially understand what we were doing, over the 6 months, they did shift in their attitudes toward the program to a positive one of recognizing how much their patients were benefiting. This slide shows you a sample of some of the Reiki hand positions we've used with patients in the cardiac cath lab during our program. And I want to share with you one healing outcome for one of our people. Mr. D was a cardiac cath patient, about 59 years old, who had to go on for bypass surgery. But post-surgery was not responding appropriately to the multiple efforts to extubate him. Every attempt to do so resulted in increased agitation, elevated heart rate, blood pressure, and respiratory rate. Reiki therapy was requested both by his nurse and by his doctor to see if we could help to lower the respiratory rate. The result was, after 5 minutes of Reiki, with the doctor standing next to the bed, he looked at the monitors and said, "I can see you're having an effect already. His blood pressure is starting to come down." After 1 hour of Reiki, his respiratory rate went into the mid-20s, and this was out of 30s and sometimes 40s. And later that day, he was extubated successfully. He received, on 2 subsequent days, 2 more Reiki sessions, and by the weekend, a total of about 4 days, he was discharged home. We do have a Reiki, or a website that you can go to. It's reiki.nu, N-U. reiki.nu. And in this website, you can click on various pictures for self-treatment and also for treatment of others, a more expanded list. As a result of success of this pilot program, GW Hospital has authorized the expansion of the Reiki program, and we are now training volunteers to deliver relaxing touch, not only in cardiac cath, but in many other departments within the hospital. As part of our volunteer program, we also treat families in the hospital, and we also treat any staff who are in need. We are also in an a national initiative, a study in which we are participating in a pain and palliative care program to reintroduce spirituality to nurses so that they can discuss these very important issues with their dying patients. And although we have just begun this in the last few months, our goal is really to train enough volunteers that we can be in every department within the hospital. There is also numerous research that's going on. Currently, there's 3 clinical trials and numerous research projects. If you go to the website at nih.gov, click on NCAM, which is the complementary alternative division, and then search under Reiki or search under clinical trials, you'll be able to access any of that information you would like to further investigate. But at the Cleveland Clinic, they're using Reiki with a study of prostate cancer because prostate cancer causes so much depression. They're using Reiki to see if that minimalizes the depression and therefore aids in the recovery. At Harborview Medical Center, I believe in Washington State, they're doing a fibromyalgia study. And at the University of Michigan, they just completed a diabetic foot pain study. Reiki was used to reduce diabetic foot pain, which then made the patients more active, which then impacted their cardiac status. In the cardiac cath, one of the things we try to help patients to do is to tune out the noise. It's a very noisy place. Our cardiac cath happens to be a thoroughfare. People are always walking through it to get to somewhere else as they're waiting. And we use headphones and we use portable CD players, and this is one of the music pieces that we use. It's called Liquid Mind. And we use this because it has very little up and down. It's a very soothing, steady tone. And as we apply hands-on, the patient's face starts to change. It goes from being tense and wrinkled, furrowed brows, to just letting go. And I showed you in the previous slides some of the Reiki positions that we use, and we really propose, because patients oftentimes have all kinds of catheters in and IV leads, and they're just full of tubes. With Reiki, you can just access any part of the body. Maybe you can touch a leg. Maybe you can touch their foot. Maybe you can hold their hand. Sometimes we can't because there are back of the hand catheters that are in. Another great place when someone's in distress is the back of the neck. In fact, people end up with headaches because they haven't eaten, they haven't received their meds yet, and a headache is a common side effect of just preparing for the procedure. And a hand behind the neck, at the base of the spine, at the base of the head, can help to calm and sometimes take away that headache. As part of our experiential, I want to demonstrate to you the basic 12 positions for self-treatment. And if you'll do these with me, and just put your awareness first on your breath. We've been sitting here all morning listening to these talks. Some of you have gotten up and down, but a lot of you have just stayed in your seat. So if you could just kind of take a couple of deep breaths, let the diaphragm relax. And I'm going to run through quickly, just demonstrating what the basic 12 positions are. The first position is always over the eyes. We always use the palm of the hand. So if you'll try that, it's not going to be very comfortable because you're not lying down, but over the eyes. If you're working and you're using a computer, you want to try to do this several times a day. It's just for 30 seconds or more. Cover your eyes. This helps you to tune out the outside world, gives the muscles of the eyes a break. The second position that's very valuable is the jaw. All of us, 99.9% of us hold tension in our jaw. And if you just touch these muscles, they get the message to, I don't need to hold on here. This muscle tension in the jaw frequently leads to neck and shoulder pain, and in addition, headaches. So if you have chronic headaches at work, from the pain or from the tension that you're holding in your jaw and shoulders, try this technique. Mm-hmm. The next position, the third position it's called, is the back of the head. So you stack your hands one on top of the other. And this is called actually the letting go posture. So when you're lying down, you know, you've probably been in a hammock or at the beach and you've put the hands behind your head and let go. And that's exactly what it does. It allows the worry centers to actually just drift to the back of the hands and float away. And the fourth position is on the throat. And the throat is the center of a lot. The throat is the center of our ability to express who we are. It's frequently a place where we get sore throats or we start to have a cold and we feel it in our throats or our neck. And it's also a way station between the heart energy and the mind. So calming the throat, it's also the thyroid, which has to do with our, what do we do with the thyroid? Our metabolism. So calming your metabolism, balancing your metabolism. Great, all right? Now down the front of the body, it's very simple. You come into heart and lungs. Breathe into the hands. Great. Many of us who worry carry around a lot of tension. We're going to move our hands to solar plexus. This is also a perfect spot for nausea control. Great. All right. And then a little bit lower, what we call low belly. Try to breathe into your hands there. If you don't feel your hands moving there, then you're holding your breath in the upper part of the body, and you really need to let go of the belly. You really need to move them down here. Try to breathe into that. And the fourth position on the body, the front, is at the juncture between the legs and the torso. This is where that catheter goes in for cardiac cath. And so I always try to treat that area before a patient goes in for his procedure, and afterwards for healing. We're using touch really to activate the healing response in the person. Joel called me a healer. We're actually all healers. We all heal ourselves. All our patients are healers. What he means is that our role in the hospital is to help people recognize their own healing ability and to help provide that environment that will help them to do that. So we're kind of the patient advocate for understanding the emotions and feelings the patients are having and helping them to cope. For the back, it's very hard to treat your own back, but you can do it. And what we recommend is you put one hand on your shoulder and one hand hugging yourself. And this will give your back actually a nice little stretch. And then you reverse the position. And then one of the most important areas of the body to treat is the mid-back, which is where the kidneys and the adrenal glands are. And when we get into that fight, fright, or flight mode, this gets really activated. And if you're working long hours and have great responsibilities at home, this is where you're going to feel it when you start using adrenaline to run your day. And then the fourth position on the back is really the low back. where many of us carry back pain. And by regularly treating your low back with your hands, you can at least counteract the tensing muscles that go along with that stress there. So those are your basic 12 positions. A normal Reiki session, if you came to me privately, would be an hour to an hour and a half. And I would use my hands in those locations for anywhere from 5 to 7 to 10 minutes in each location. Depends on how I feel that you need it. But at the hospital, we do our treatments much more quickly. One, because one of the principles of Reiki is that the sicker the person is, more of it comes available for them to use. So a typical session at the hospital might be anywhere from just a few minutes, hands-on, to maybe 20 or 30 minutes. That would be about the longest session. All right, thank you. And my final thought for you is that healing is a dialogue that the unconscious has with itself, and that touch is one facilitator of that conversation.